Thank you, Mr. Chairman. Mr. Wise, what are some of the key differences between how VA manages major medical facility construction projects compared to federal and private sector stakeholders responsible for similar projects? What are the likely effects of these differences?
Well, Mr. Coffman, two things kind of stood out to us when we did the work for the April 2013 report, and one was, and I think this has been discussed especially in panel one, the early entry of medical planners, medical equipment planners at the early part of the planning process, which when we discussed our questions and our issues with both the Naval Facilities Engineering Command and with the Army Corps of Engineers, they were both very, this was a very important item to them. These units work hand in glove in order to make sure that you have a parallel and symbiotic relationship between the people who are building the facility as well as those who are bringing in the equipment that the facility needs to house. Obviously, those things need to be completely compatible. Otherwise, you've got some disconnects, and the inevitable result is change orders, which add time and cost to the project. And that's my second point. The change orders, also when we've discussed with people in the private sector as well as with folks at the NAVFAC and the Army Corps, both seemed rather surprised at the amount of time that it took the VA to administer change orders. And I think that was also discussed fairly thoroughly in the first panel, but we saw change orders, I guess it had taken sometimes up to a year to implement, and this causes a lot of problems for the contractor, because then he's waiting for payment while this whole thing kind of winds its way through the Veterans Administration's approval process. They've done a couple of things I think that may help in that process. They've raised the threshold a bit, up to $250,000 in some cases. They hired some additional attorneys that deal with the change order process. So, you know, how this will work going forward, we'll see. But those are two things that really stood out when we did the research and the work in order to produce that report.
Okay. And I think in your report you also reference that the Army Corps of Engineers has built similar projects for the Department of Defense on schedule and within budget. Am I correct in that?
They have a track record of building a lot of medical facilities. That's true.
But on schedule and within budget?
Their track record is fairly positive as far as we could tell. They certainly not on the magnitude of what we saw in the four major projects we looked at in the work on the VA.
Okay. Mr. Kelly, in your testimony, you rightly acknowledged that many of VA's major construction projects were funded years ago, but very little progress has been made, giving rise to safety implications. What would you recommend VA do in the future to expedite its processes in order to avoid these same mistakes?
There needs to be a prioritization of these, and the SCIP process does that, but then on the implementation side, there seems to be a failing on that prioritization. So we've got 9 of 12 seismic correction facilities that are partially funded at some phase. Some of them have been funded since 2010, and no money's been spent on them. And we need to understand why that money has been allocated and no progress has been made. And should we have entered into that contract to begin with if we weren't ready to start the project as soon as the contract was completed? What missing link is causing that wait? And what is that money having to be repurposed to another program, and now we're waiting for money to be repurposed so we can start it? There's a lot of questions on the timing of funding and where that funding is sitting.
Okay. Mr. Wise, the GAO report states that the problems experienced at the audited construction projects were representative of systemic problems throughout the VA. Could you elaborate on how these problems extend beyond just the facilities you assessed?
Well, if you look back at the 3 recommendations that we made, they point, and this is generally how GAO works, we're looking for systemic issues that have a broader impact or a broader effect. And when we looked at the three recommendations we came up with, it had to do, that dealt with the lack of communication and the inability to pinpoint exactly who's responsible for what, the issue with change order administration, and those kinds of problems. And we saw that these are the kind of things that have broad implications in terms of being able to administer what are very complex and very expensive projects.
Very well. And so I think in your report, you said that each of the hospitals under construction at that time, and I think there were four, were, I think, over several $100 million each on average over budget, and about 3 years behind schedule on average. Is that correct? And then would the Aurora situation be the worst one out of the four?
Aurora had the most egregious overruns, both in terms of cost and delay.
Okay. Okay. Thank you, Mr. Chairman. I yield back.
Thank you very much.